بالنسبة للأوبراتيف في محاضرة الدنتال كيريز حكينا how we can manage dental caries and after we diagnose it. In some cases we may see a deep carious lesion that may involve the pulp. At this lecture we will talk about deep carious lesions in primary teeth that may affect the dental the pulp in the pulp tissue. بداية ضروري نميز إنه ممكن يكون في عنا deep carious lesions في primary and permanent teeth. حتى permanent we may face mature and immature permanent teeth. Mature means that the root is completely formed, and immature means that the root is not completely formed. This means that we have open apex for these teeth. بالبداية في حالات small carious lesions المانجمنت ما بتختلف for primary and permanent. We can do filling. إذا كانت deep caries very deep في ال primary teeth and reaching the bulb, we can do different procedure. We can do a liner if it's very deep and reaching the bulb without doing exposure. We can do indirect pulp capping. If we have a exposure, we can do a procedure called pulpotomy. In some cases, we can do direct pulp capping, but it's not preferred for primary teeth to do direct pulp capping. We can do directly coronal pulp removal. This is called pulpotomy. We will explain it later in this lecture. And if the pulp is completely inflamed and necrotic, we can do a procedure called pulpectomy, during which all the pulp tissue is necrotic or inflamed. While in permanent teeth, if we have deep carious lesion and there's an carious tissue, we can do carious tissue covering the pulp. We can do indirect pulp capping. If it is reaching the pulp and the pulp exposure occur, we can do direct pulp capping. If the pulp exposed in a big exposure and the bleeding is excessive, we can do a procedure called pulpotomy, during which we remove a small amount of the pulp. If it is more inflamed more, we can remove all the coronal pulp, and it's called cervical pulpotomy. And if the inflammation reaching all the pulp, we should do RCT, root canal treatment. The difference between mature and immature, always in mature teeth, we go ahead to root canal therapy, while in immature permanent teeth, we always try to keep the vitality of the root in order to allow the root to be formed completely. This procedure called apexification, if the radicular part of the bulb is necrotic, and called apexogenesis if the radicular part of the bulb is vital.